to formally and warmly open the SIHI Talks, and of course give an introduction also to our main speaker for today, Beatrice.
Yeah, thank you, Meredith. Thank you, everyone, for joining. Hello and good morning, good afternoon, depending where you are. It's a pleasure. I think it's the third SIHI Talk, and yeah, I suspect that I'm welcoming and opening as the initial partners we introduced were through discussion I had. So it was interesting. But if you have also all the hubs interest in providing and wanting to have some ideas for the SIHI Talk, it's really open to everyone to bring in ideas. So today is very interesting, and we're very pleased and honored to have Uche Amazigub, Professor Uche Amazigub. She is a SIHI champion since the beginning of SIHI in 2014. So Uche is a professor. She's a professor of parasitology and public health, a specialist. And she is a fellow of the Nigerian Academy of Science, and she retired from a job as director of APOC, that you may all know, the WHO African Program for Onchocerciasis Control. And there was the leader and the champion of the community directed intervention for the control of onchocerciasis, but also other neglected tropical diseases. And after retirement, so Uche set up, she's the CEO of an NGO called PACIEH. So this is the Pan-African Community Initiative for Education and Health. And PACIEH is in Nigeria, and she will all tell us about this. And for a long time, since 2014, when we have started SIHI, Uche has been supporting and championing SIHI, and was until recently a very important member of the TDR's external advisor and review group for SIHI. And now that Uche is willing to actually engage and is becoming a partner and a collaborator with PACIEH, things are changing, and we are welcoming Uche as actually a member of the contributing partner. So we'll be very interested to hear some new thoughts as well of how she sees maybe PACIEH can contribute to the SIHI vision, but also some potential collaboration that can be based on integrating in a medical center a social innovation lab to incubate new innovations. So this is something that we'll hear about. And then we'll hear Maria Isabel, that you all know, the lead of SIHI LAC, as well as Yana, the lead of SIHI Philippines, to share their views as well, and their part of what this collaboration could be. And Meredith has kindly agreed to facilitate that discussion. So over to you, Meredith. Thank you all.
Thank you, Beatrice. Yeah, I think this would be a very interesting discussion today. So without much further ado, we're now ready to listen to Dr. Uche's presentation. So Uche, the Zoom platform is yours. So Joreb, is it
I think Uche will
Did we
be
lose
present.
Uche?
Yeah, she was coming in and out of the meeting
I think she was
during.
disconnected. Yeah, but I think we can help her put up the slides. Yes, she was here earlier. There. But Uche, if you're already ready and you're back in the Zoom room, uh, Joreb has already shared your slides, so you can have the platform. And in case you're saying something,
now I think
there.
now you can hear me. Can you?
We can hear you. Yeah.
Okay.
Go ahead, please.
So just let me try and share. Yeah, thank you very much for thank you very much for inviting us. My name is Uche Mazigo, and I'm going to talk about what PACIEH has been doing. As you can see, PACIEH was founded in 2013. We have trustees, and two of them are online joining us in this meeting. We have the technical advisory group, and also we have project manager. PACIEH is a not-for-profit NGO with headquarters in Enugu in southeastern Nigeria. Our vision really is to provide children in resource-poor communities with good education, functional primary education, secondary education, and also good health opportunities to access health. So, and empower communities. We started our program in 2013, and in 2013, we decided to establish a school health, sanitation, education, and feeding program. As you know, a school feeding program in a resource-poor environment is an investment in human development, but can be a good investment if it is sustained for a number of years to allow for a reversal of severe micronutrients and other nutritional deficiencies in children. So with that in mind, we focused on sustainability as a core value of our programs. In 2013, we searched for an innovative approach that will help us to have a sustained school feeding program and good education in a resource-poor setting. We developed what we call the community managed school feeding strategy. And we had our nutritionists to train, to co-design with community people school meals so that the communities decide on the type of meals, and the cooks were selected by the communities and were trained by the nutritionists of PACIEH. Then we determined with the community, we co-designed with them the steps for the implementation, and the communities selected the cooks who are primarily female cooks. By 2016, we had 72 female cooks. The partners also agreed that a community would take leadership in this program. And so we established two models, two partnership models. The first one with community, state government, and the private sector companies. The second model, we had community faith-based, so we did not have the state, and then we had the private sector. The partners built school kitchens, hand wash points, and later on, in fact, gave boreholes for potable water to the communities, and a number of built schools indeed for communities. The Nigerian breweries, the Henneken Africa Foundation stepped up and provided a lot of infrastructure in our schools. But by 2016, the government that had sent, the federal government between 2014 and 2016 had sent a number of staff from the federal government office, the presidency, vice presidency office, to study the community managed strategy that we were applying. And they were very thrilled with it. But when they launched the National Homegrown School Feeding, they took only a part of the community managed strategy, which is to involve women as cooks. But then, unfortunately, the program was politicized at the national level and state levels. So many of our cooks lost the opportunity to serve as cooks in the schools where their children are studying. And to cushion the shock the cooks had from the political interference in community managed in the homegrown school feeding, they were laid off, quite a number of them. To cushion the shock they had, we established, we assisted them, the women, to form cooperative society and train them on resource management and business management. And also we maintained the model 2 of the community managed school feeding, where the community, the private sector, and the church were in charge of that strategy. And we launched in 2016 a school eye health screening program and the warming program as well. The same year, in 2016, we were invited by the Anambra State government as in an advisory capacity to assist the government to review the policies on girl-child education in the state and to initiate other programs that will improve the high school education sector of Anambra State. And so by between 2016 and 2019, we had coordinated multi-sectoral, multidisciplinary research for the state government and the World Bank, starting from the girl-child study to monitoring the learning achievements of students in public schools, and monitoring the achievement of science teachers, which we found very poor at the beginning of this research, and building capacity of teachers and expanding that capacity. The outcome of the PACIEH interventions, starting with this, the education program for Anambra State, is the establishment of a special education program for promising rural students, because in the girl child study, we found a number of very brilliant rural students, but they had no opportunity to improve their education. So by through advocacy, we were able to get the state government to sponsor 108 students from rural villages to top schools for a 6-year program. Schools that had modern facilities, good environment, excellent academic record. And we're very proud that today, this year, this particular year, we have a number of those students that have completed their education and they're in their A class in terms of performance. The other outcomes of PACIEH's work is that when we started the community managed school feeding, we realized after a year, there was an outbreak of measles in children in 2 rural communities at the inception of our program. But since the school feeding with sanitation and health and feeding, we now have absence of outbreak of measles in those 2 rural schools. There was also a strong reduction in the underweight of pupils in the schools, and 17% of the over 2,000 pupils we have screened for eye health, eye infection we provided them with spectacles, dewormed for 3 years, almost 1,500 children on yearly basis. And we invited doctors, specialists to also examine children for ear, nose, and throat infections and treated them. But this particular program on ENT, we could not sustain because of lack of funding. As I mentioned, the partners provided portable water, toilets, school kitchens, washing points to improve the environment, and the over 600 pupils also were provided with infrastructure. Retention of school children in rural schools, in our schools, went up by 99%. In fact, we are always proud to say that for the 3 years we did the community managed school feeding, no child missed school for 1 day. And the number of dropouts, as we said, was less than 1%. And we had changes in the Ministry of Health on the education program. Now, the other important outcome is that it was not only the National Homegrown School Feeding Program that picked up part of the strategy of PACIEH in this innovation on community managing school feeding and taking the lead. It wasn't really the only group, the national government. The T.Y. Danjuma Foundation also picked up, studied our strategy, picked it up, and are implementing it in 2 schools in northern Nigeria up to date. And as I said, our model 2 has been on from 2013 to date. Now, in this year, we were very fortunate that we got approval from the T.Y. Danjuma Foundation. They are going to fund us, and the construction has already started, to build a medical center, which they will equip completely here in Enugu, but on the outskirts. This medical center is to provide services to poor families by medical consultants, because this city has has at least 2 big teaching hospitals, number of private hospitals. And so there is a pool of medical consultants and specialists here. We want to tap into that pool, and we have already started dialogue with them, and a number of them have agreed to provide pro bono services to low-income families and free services. We're going to also introduce an innovation in this center, and that is treatment for 2. If you're a middle class or well-to-do person, we will invite you to join GMC as a member or associate by paying for your own treatment and paying for the treatment of an indigent patient. We will try to see if we can adopt the health center by phone, the Malawi innovation, because we think that will provide excellent services around in the environment on the outskirts of this city. Now, our question to the SIHI network is, could Goodwill Medical Center be considered a research incubator for SIHI? That is a facility for designing, developing, and incubating ideas, a resource center, a data repository for SIHI, a center for training and retraining emerging leaders in social innovation. So apart from that, we also put up some points on sustainability. You have seen from the presentation that we paid a lot of emphasis on mentorship, building capacity of the community and the local people. The business women that we trained, we brought out of the shock from the interference of politics, went into food production, some of them, so producing and selling soya milk. And we also placed emphasis on co-creation, inclusivity in the program design and management. And that is what we did now. We did for the school feeding, we still do it for the school feeding, the private model 2 and the iHealth. And we provide unlimited access. That is, the PACIEH academic and technical team members provide unlimited access to young students, to lecturers, to colleagues, and act as advisors on nutrition, public health, infectious disease experts. We are sustaining our school eye health program through local philanthropy. I think this is something that PACIEH brings that is original, in my view, from my colleagues. That is, we decided to tap into the Igbo people's cultural practice, creating a financial system for communal health and well-being. That is, in this case, we don't send proposals to North America or outside Nigeria. We engage successful entrepreneurs in Nigeria to sustain and expand school health program in their communities. So they pay for the school health screening programs in their communities and other remote schools. So we have used this since 2016 to sustain the community, the school eye health screening program. Now, the challenges we have had, I've mentioned it, and you've seen it in Model 1, in slide 5, the politicization of the program by government that made the women to lose that spirit of volunteerism, and there was a decline in commitment in the school feeding program, the national school feeding program, because the states were not ready to support the federal government in that program, and the quality and quantity of meals in the national school program also declined, which is what we never witnessed in the community managed strategy that PACIEH had led. The other sustainability challenge we have is funding school feeding was no longer attractive to philanthropists. Immediately the government got involved. It was difficult to ask the local, Nigerians, philanthropists to also fund those schools that government are not funding, which are not the public schools. Now, in summary, I would say that we have the comprehensive care for rural school children. As I said, for 3 years, uninterrupted meals, we improved their education, nutrition status, and we established public-private partnership. Then we continued the private sector funding. We also played a lead role in secondary education in Anambra State, and we are continuing in that advisory role up to date. We are also advisor to SIHI Nigeria, OCA, and we continue with this private sector funding of the eye health. Not only have we treated or examined and treated over 2,000 rural school children, but also about 250 teachers, provided glasses, trained the teachers on eye health, and continuously provide health education. Now that what we're adding from this year is access to quality health care for low-income families. I would like to thank our partners, Henneke Africa Foundation, Netherlands, the Royal Thai Embassy, governments of Anambra and Enugu, and then the True Value Nigeria Limited is the philanthropist that is leading, funding the eye care programs for us in many areas with the Royal Thai Embassy. And then the T.Y. Danjuma Foundation for stepping up to help us to provide access to healthcare services, free access to healthcare services to poor families in this environment. And the Dr. Achufisi, the philanthropist, is also funding the school feeding, that Model 2 from 2013 to date. We're still on that program. Thank you very much. Thank you for your kind attention.
Thank you, Uche, and of course, congratulations to PACIEH for a very excellent. I think you're doing an excellent thing, especially in the community. And I think for us here in the network right now, we kind of picked up many important things in terms of sustainability. Of course, what Uche shared has not been sugar-coated. We've also heard of the challenges, and I think what was interesting was how PACIEH was able to, go back and address the issue of sustainability, and not only sustainability, but cautioning, the social innovators also and the community from the impact. I think we'll go back to that in a while. And of course, the second interesting point is what Uche mentioned about Goodwill Medical Center as a research incubation hub, possibly for a model that we can look at as a network. And she also talked about many things on mentorship, capacity building, co-creation, and of course, inclusivity, how to engage the social innovators. We'll discuss that more together with the other hubs, starting with, of course, the experience of the Philippine hub, and connect this with later on. We'll go back to Uche's discussion. But let me ask first, Hannah, the hub manager of SIHI Philippine Hub. We also have experiences on engaging the social innovators in research and capacity building. So can you tell us more about it in the context probably also of GCARC? And
Yes, thank you very much, Dr. Meredith. Hello to everyone and mabuhay from the Philippines. First of all, I would like to thank Dr. Uche for that very inspiring presentation. And I note some similarities also in the work of PACIEH and what we are trying to do in the Philippines. So to share, as mentioned by Dr. Meredith a while ago, we have been able to institutionalize here in the Philippines the identification and the open call for social innovations in health through a national award that is given by our Department of Science and Technology, Philippine Council for Health Research and Development. And we call this the Helia Castillo Award for Research on Social Innovations in Health, or the GCARC. And we've been able to run this already for 2 times. So the first one was in 2020, and we just finished the call for this year, 2022. So we received submissions from all over the country, which undergo screening and scoring processes for us to select the top 10 finalists, and then from there, top 3 grand winners are also selected. So part of the prizes or the incentives of the winners, actually the finalists and the winners, they undergo a training and mentoring package, and this consists of a series of sessions with topics such as our country's health innovation ecosystem, strategic planning, and business models for social innovations, and even writing research grant proposals. So actually the design of this whole package is based on a needs assessment and from the insights already of the innovators, because from their entry forms that they submit for the award, we already ask them what their needs and challenges are for sustainability, how they think their innovations can be integrated into the broader health system, and how they think research can actually already help their innovations move forward. So all of these things that they write in their entry forms, we review, and this informs the design of the training and mentoring package. And as I mentioned earlier, a big component of this training is already about drafting research grant proposals. And this is because the top 3 winners, as part of their prizes again, they have access to a grant that is given by the Department of Science and Technology. So actually, one of the outputs of this whole training program is that they are able to already write a full-blown proposal, and we actually help them also and guide them for the whole process up to the technical review, the ethics review, and until the proposals are actually approved already for funding. And throughout the process, as mentioned, there is also a mentoring part of this. So they are matched with a mentor that has experience and expertise not only in research and innovation, but as much as possible, we try to match them with a mentor that has similar work as their innovations. So we are very happy to share that the 2 of the 3 winners of the GCARC 2020 have already had their proposals, research proposals approved. They've accessed the grant already, and they're actually already implementing the research projects. So one is doing a valuation study, so they're evaluating the economic value of their enterprises model, and the other one is looking into the effectiveness effectiveness of their mental health programs and services based on end user outcomes and other program outcomes. So we are also very excited because we are already about to start with a training and mentoring package for this year's winners. So thank you very much for this opportunity to share our experience here on how we try to support the social innovators in capacity building and research. Thank you.
Thank you, Dr. Hannah, for sharing those wonderful things that are happening in the Philippines. And let me also pick up what you just said earlier, that this mentoring and also helping out the social innovators in terms of writing the proposal and even journeying with them after the crowdsourcing call was not just the idea of SIHI, or the Department of Social and Technology, but this came from the social innovators themselves. So based on an assessment that was able to inform decisions later on that led to this mentoring and capacity building. I think that was a very important point that you shared. It has not been an easy journey, but thank you for sharing also the current status of those two innovators from our first call. So from the Philippines, we'll jump into LAC, and they have also been doing a lot of very interesting crowdsourcing calls. And also part of that is capacity building and journeying also with their social innovators. So can we ask Maria Isabel to share a little bit about this, and what do you do in your context regarding mentoring capacity building?
Thank you, Meredith. Can you hear me?
Yeah, we can hear you well, Maria.
Okay. Thank you, everyone. Thank you, Dr. Che and Hannah and everyone for sharing these important reflections. So I want to share with you that from our organization, the CDAIM is the organization where I work, and is the where the SIHI Hub is hosted, and it's a research center. Therefore, building capacity around research. Sorry, there is a sound there. Can you hear me?
Yeah, we can hear you well. So maybe Jorab can help us mute the sound.
Okay.
Go ahead, Maria.
Okay. So I was saying that it's a research center. So research or building capacity around research is at the heart of the organization. As Hub, we started 6 years ago. First building capacity within our own team, and then promoting learning spaces and capacity building strategies for research targeting different actors and sectors across the region, including public and private organizations and nonprofit organizations as well. So through crowdsourcing calls in collaboration with partners such as PACIEH, we have identified 20 initiatives from 10 countries in the Latin American region with potential for social innovation in health from different sectors. So we have, for instance, 8 innovators that have emerged from the academia, not necessarily all of them with extensive research experience. We also have 8 innovators coming from that are health implementers. 4 come from the private sector and 4 from government organizations such as the National Institute of Health in Colombia, or some local health secretaries from a small town next to the capital. And there are other 4 innovators coming from small foundations or community-based organizations. So as you can see in our group of innovators, there are different levels of experience in research, from high experience to any experience. Therefore, our efforts to strengthen capacity in research have promoted in particular community-based participatory research at different levels. So I'm going to share with you 3 strategies that we have used. The first one is that we have promoted collaborative work between hub researchers and innovators to develop case studies and other research studies. So we develop qualitative case studies on selected social innovation, as all the other hubs as well, where researchers of the hub in collaboration with innovators develop a rich description of each social innovation component and lessons learned. In addition to the case studies, we have also, with innovators that have some experience in research, we have promote collaborative writing of other research efforts and results. So we have so far 4 additional publications in collaboration with members of the hub and innovators. One example is an article that with the National Institute of Health that analyzed one of the innovations, the social innovation SIHI kits. This article aims to illustrate how a research-oriented program can provide valuable data that could be applied in the design of public health policies and create impactful changes at the health and social system levels. A second strategy that we use is that we try to strengthen capacities through the organization of learning spaces and training workshops for less experienced researchers, for instance, among the group of innovators. So since 2017, we have started efforts to strengthen capacities around research with a particular focus on community-based participatory research methodologies. And again, we started strengthening our own capacity first, and then we try to, one of the leaders of the hub, of the researchers of the hub, appropriate the knowledge that we acquire first and transfer this to other allies, to other innovators and other members of ALASIS, which is a multi-actor community of individuals and organizations that we are creating in the region, that people that is interested in social innovation in health in the LAC region. And a third strategy has been the search for institutionalization and promotion of social innovation in health in formal university programs in Latin America. So some examples are, we conduct some efforts at the Universidad Nacional Autónoma de Honduras in Honduras, where we hold several academic events since 2019. And in collaboration with the Honduras Hub, there was a virtual training space designed for students from health programs. And in addition, we try to link one of the innovators from Honduras to the university, with whom important efforts were made to expand the innovations. Another experience of institutionalization happening in Colombia at one of the most important public universities in the country, the Universidad of Antioquia, where an institutional call was launched this year to recognize social innovations within the academic community, including professors, researchers, and students with the school of, within the School of Public Health. From this call, 2 initiatives were identified, one of which is currently being documenting. And in the same university, several academic spaces for dialogue and discussion around social innovation are taking place with students and professors. And finally, in a private university in the southwest of Colombia, the SIHI University, efforts are taking place to integrate social innovation in health perspective into a master's program in management for social innovation. But this program is more, it has more like an entrepreneurial approach, but we have now the opportunity, one of the researchers of the hub has been invited to be a professor. So, and she has been able to incorporate the social innovation in health perspective into the program. And because of this, we are currently integrating one of the students of the master as intern of the hub, who will carry out a thesis project with the hub, and it will be focused on formulating training proposals, formulating a training proposal in social innovation in health for health faculties in Latin America. So to close, I will say that the hub has a strategic position to bring together different actors and to serve as cross-disciplinary and cross-sectoral platform to promote research around social innovation. But of course, many efforts are still needed, and I will say that they should include continue to providing training and mentoring alternatives to grassroots organizations to document and make visible their innovations, and also, of course, disseminate and socialize these experiences among decision makers and other key actors to advocate for their inclusion on the public agenda. So thank you for listening. Over to you,
Thank
Meredith.
you. Yeah, thank you, Maria Isabel, for sharing that. I think we've seen a lot of intersectionalities with what Hannah has just shared also, and what Uche has shared in their different contexts, and how really the support to social innovators, not just during the open call, but even beyond that, no, in especially in documenting, putting their work into research and publication, and of course sharing this to especially to similarly situated communities, plus of course influencing policy and attracting donors, no, in the all in the context also of sustainability is very important. And yeah, I think Beatrice has also written in the chat box how how this will help sustain and enhance, of course, the impact that we want to show, because it's important that we show evidence and impact. And this success will also be the success not only of the hubs, but as of the network in general, especially moving forward to the conversation on sustainability. And thank you also, Kathleen, for sharing the link of the case studies of LAC in the chat box. So let me just connect this a bit to what Uche shared, and maybe we'll also ask Uche to share a little bit more. The two other hubs have shared how they're working with social innovators on writing this down, putting this into research. And now that you've mentioned about the possibility of Goodwill Medical Center as a research incubation, how do you see this work? And probably after Uche gives us more information about this, I'll also ask later on the hubs how do they see this moving forward. So Uche, can you shed more light on the Goodwill Medical Center as a research incubator?
Yeah, sometimes it is difficult to bring researchers together and tap from them or help them to devise or design innovations. Some may have the innovations, but how to put that together, how to package it. So the idea here is to have a meeting place, an incubator place for where we can bring in, engage emerging leaders in social innovation in this country, in West Africa, to come together and have sessions where they can exchange ideas, like what Maria was saying, research ideas, you know, and that could be online, but they can have face-to-face training sessions, retraining sessions, discussion sessions, so that we begin to grow the number of social innovators that are, you know, that are, and allow them to network better than what we are doing now in our own West African region. That's really the thought. In Nigeria, we need to grow this research and reach out to more social innovators. So this center could provide the facilities to do that. And I think it is something that will help SIHI to bring up or to identify, support, and encourage and energize more young people to join the social innovation network. So it's a center, I think, that has a lot of potentials to provide to SIHI. But I have colleagues here who might want to add more. And as you said, Meredith, the hubs can also, this is just a question we're throwing to you. I know that the hubs and you, especially the Secretariat, you have better ideas on what you can use this center to do. Thank you. Over.
Thank you for sharing that. And now we see a bit of clarity of how this research incubator spaces for conversation and exchange would work. So there's an interesting question that Beatrice posed in the chat box. So it would be great to know from various hubs whether there is space and relevance for the hubs to establish or host incubators. I think similar to what Uche and her team is doing of social innovations, like bringing together stakeholders to identify issues and develop solution. And it would also be interesting to know if the hubs could also support innovators across the country. So it's like a cross country collaboration or a social innovation exchange. So anyone is free to comment on that or to add on to that discussion. So anyone from the group, you can just unmute or you can raise your hand so that we can acknowledge. So is there space in our own respective hubs to do this, to do what PACIEH has actually started doing already?
Maybe I can jump, and I'm not sure. I think Luis
Go ahead,
Gabriel
Maria.
was in the audience. I don't know if Luis Gabriel wants to share a work that he's starting in PAHO in collaboration with the hub and around internships between innovators. Luis Gabriel, are you there? Can you share a little bit?
The innovators in the region of Latin America and the Caribbean had asked in an event that we held a couple of years ago in Cali just before the pandemic that they would like to have more exchanges. So because we document the innovations, we thought that there was a way of kind of, getting to outcomes in one, and that is having the exchanges of the innovators and guiding them on the documentation of the innovations, but also creating that kind of relationship between them. So we are finding the best fits, the best matches between innovators, the ones that have been recently recognized and the ones that have been for more time with SIHI, to have those exchanges. And we are providing them with the framework of how to document those innovations. And we are piloting this. We will assess it and see if it's worth continuing and what needs to be improved throughout the process. Thank you very much.
Thank you for sharing that, Luis Gabriel. It's good to hear your voice again. and I think it's interesting how, the exchange in interns, and we've talked about this also before, like exchange in fellows in SIHI. I think that has been the plan, but you have actually already started doing it. And I think some of the hubs also are attempting to do that. I think the exchange in ideas in social innovation and providing a platform for that is very important, especially for new social innovators, for the next generation also to have all these ideas, and it would be good to come together and exchange some of this also. And I think Hannah would like also to share some of there's something cooking on learning exchange, also related to this, Han.
Thank you, Dr. Meredith. Yeah, it has been cooking for quite some time now, a few years. But what came to mind when Dr. Uche was sharing about that incubator, but the one what that she was sharing was an actual physical space, which is really good. But what we have been trying to develop also and propose, this is still actually in the proposal stage. We're trying to get funding from our Department of Science and Technology again. But we have conceptualized this in the past 2 years with MAD, actually from Sweden, and also the Zwilig Family Foundation here in the Philippines. It's an SIH exchange platform. So it's trying to do what Dr. Uche described, but in a virtual space, which can be done both synchronously but also asynchronously. And we thought of something that is a bit different from the SIHI website, in that this can host forums and communities of practice. So the idea is just really simply a space to share ideas, even just ideas, but also maybe innovations that are already ongoing. And this is also a space where innovators can interface or connect with other partners, funders, technical assistants. So we were hoping to create a database of these, like innovations, innovators, different partners, different types of partners. So initially here in the Philippines, but hopefully we can also make it a regional or even global later on. We're also thinking that it will be a repository of learning materials, and hopefully also in the future even to host online courses, no, and modules. So again, we are still trying to get this approved by our Department of Science and Technology. We are already in the external review phase, hoping to get the funding by next year, and we will really update you. But the idea is very similar to what Dr. Uche has described, and we hope that we can also exchange more ideas on how to actually moderate and run platforms such as this. And one big component of the project also is that we will not go right ahead to the web development. We will do a series of workshops first with key stakeholders and potential users, no, with the of course, our process of co-creation that we always also talk about and advocate for. So thank you. That's a little update also from the hub.
Thank you, Hannah. So there you go. There are two models that are now in discussion. So one is an actual physical space of social innovation exchange, and another is a virtual platform exchange. And I think both can work well depending on our context, and even we can even merge these two, sort of a hybrid. So all in the conversation about social innovation, how we journey with social innovators, how we promote impact, and how we show our work, of course, especially to policymakers. So this can also influence public health policy, and even attract more partners and collaborators, moving towards also the discussion about sustainability, both for the hubs and of course of the network. So Uches also shared that their GMC Incubation Lab provides the SIHI Secretariat opportunity to meet and train social innovators from several countries. And this will be a very good opportunity, exchange ideas and collectively co-design innovations for several countries. So this would take the role of the secretariat in another level, and I think that would be very interesting. So we are continuously exploring ways of how we can exchange ideas and innovate more, because I think that's the core of innovation, when we start talking and exchanging ideas from different parts of the world, from different contexts, and coming together, whether it's physical or virtual space, is very important. So I think before we wrap up, maybe Beatrice, you want to comment or share in the discussion before we also, I'm looking at the time. So before we wrap up the very nice and vibrant discussion, Beatrice.
Yeah, thank you, Meredith, and thank you all. I think it's quite interesting, to brainstorm like that, and if that discussion could continue and see how to grow together in a way of looking at how to support researcher like we saw with SIHI Philippines, SIHI LAC is doing this now. Also SIHI China with SESH. There's quite a lot of momentum, and that is very good. And see how then the hubs can collaborate during this, at least for certain training, like Joe is writing. Or other ways, so to embed that research. And the The other part is about the incubation, and that is, of course, very new to everyone. And I have to say, I was just asked, that's why I got the idea, was just asked, so how is SIHI, which methodology of incubation do we use? And actually, we don't really incubate social innovators. So yeah, why not? Is it, I mean, that's why I ask for relevance. Is it relevant? Is it a good idea? And it's nice to see the Jana answer, and it's already an idea, and maybe, yeah, in the SIHI lag with this idea of internship that could also bring that. Yeah, it will be interesting. But all those questions and brainstorming, I think, is very important. If the SIHI network wants to remain active, we first need to innovate, right? To always think and question how we do things and how could we do it differently and innovatively. So well done, everyone. Thank you. Over.
Thank you, Beatrice. And I think we will end with that. We have ending with a lot more questions. Every SIHI talk is, I think, a good sign that we are actually moving forward and the search for answers, because as social innovation in health network, it's always important to, think outside of the box and think in advance what's going to happen in the future, and how do we actively work towards that future and not just wait for it to happen. And I think the social innovations has a lot role in that sense. And thank you for all your contribution and all the sharing to the conversations today. And we will share, I think, we will be sharing the recording of this SIHI Talks for those who were not able to come, but who are interested also to learn more about what PACIEH is doing, and of course, its intersectionality with what the SIHI Global Network is doing. But thank you very much for coming. And yes, we will continue to explore and continue this conversation with other possible SIHI partners. And many thanks to Dr. Uche and, of course, the PACIEH team, and SIHI Philippines through Dr. Hannah, and SIHI LAC through Maria Isabel, and of course, the whole global network. Thank you very much, and we'll see you again for the last SIHI Talks this year. That's going to happen in November. So have a nice day, everyone, and stay safe.
Thank you, everyone.
Thank you.
Thank
Bye-bye.
you. Thank you, Meredith. Thank you, everyone. Thank you, Maria,
Thank you.
Isabel. Thank you. Thank you. Bye.